Hello and welcome. I'm Emily Bagwell. I'm the Bariatric Program Coordinator here at the Charleston VA Medical Center, and we are the Bariatric Center for VISN 7. I would like to go ahead and introduce our weight loss team. Bariatric or weight loss surgery is a team approach. So we have Dr. Rana Palat, who is our Bariatric Surgery Director and our bariatric surgeon. You have myself, Emily Bagwell. I'm a physician assistant and I'm the program coordinator, as well as the help with the inpatient, outpatient portions. We have Kristen Crady, who's our registered dietitian, who specializes in bariatric nutrition, weight loss. We have Dr. Travis Turner, who's our clinical psychologist. We have Dr. Tony Abramchek, who's our clinical pharmacist. We have Rebecca Lewers, who's our MOVE coordinator. Shawn Nelson, who's a nurse. She's our inpatient representative on our team. And Dr. Mark Lockett is our chief of surgery here at the Charleston VA. So the purpose of a team, as we discussed, it's a multidisciplinary team. We address the immediate health concerns. We assess clinical and psychological readiness for weight loss surgery. We provide education both before and after surgery. We evaluate your nutritional needs. We provide support groups, and we provide lifetime follow-up. So first, let's talk about what is weight loss surgery. It's also classified as bariatric surgery. Surgery is to serve as a tool to help with weight loss. It is very important, and you will hear us say many times, that surgery is only a tool that we give you. It's diet, exercise, and lifestyle changes that you do in order to be successful with weight loss surgery. The surgery changes your digestive system to help you lose the weight. This is done by limiting how much you can eat, by making your stomach smaller, and also in some cases by reducing the absorption. It is important to know that you must make permanent changes in order for this surgery to be successful. So let's talk about what overweight and obesity means. The terms overweight and obesity refer to a person's overall body weight and whether it's too high. Obesity is having a high amount of extra body fat. So let's talk about we measure BMI, which is your body mass index. Acceptable is 18.5 to 24.9. Overweight is considered 25 to 29.9. Obesity is 30 to 39.9. Morbid obesity is 40 to 49.9. And super obesity is a BMI greater than 50. So let's talk about who is a candidate for surgery. If your BMI is greater than 40, you can qualify, you are considered for weight loss surgery. If you have a BMI greater than 35 and any comorbidities related to weight, such as high blood pressure, high cholesterol, arthritis, diabetes, urinary stress incontinence, obstructive sleep apnea, coronary artery disease, degenerative disc disease, and esophageal reflux. So BMI alone does not qualify you for surgery. Other options, other areas that we look at are to have documented participation in a supervised weight loss program such as MOVE. You must actively participate in this for at least 6 months prior to being considered for surgery. Additionally, you must lose 5% of your body weight before referral can be made. You must be a non-smoker. It is very important that you're not a smoker, or if you smoke, that you stop for at least 3 months prior to surgery and be smoke or tobacco free for the rest of your life. We do check urine tests to ensure that you're no nicotine in your system. Additionally, we look at your medical and your psychiatry history to make sure there's no contraindications. So what to expect? So if you meet these requirements, you should talk to your primary care doctor. If they believe you would be a good candidate and you guys discuss that and make that decision together, they can make a referral to the bariatric point of contact. Inside the Charleston area would be the contact to me. Outside the Charleston area, we have designated point of contacts that your primary care can refer to. You'll have an initial consult team with the bariatric, our team here at Charleston. There's certain lab work that we do preoperatively. You undergo extensive nutritional education and counseling both before and after surgery. You have mental health evaluation. You'll have a pharmacy telephone consult and counseling, and patient and family education.
Hi, my name is Travis Turner. I'm the psychologist that's working with the weight loss surgery program. The overarching goal of this program is to provide weight loss surgery for those veterans who would benefit from it, but also to make sure that we don't do surgery on anyone who might have an unfortunate outcome. And that's where my role comes in with this team. Specifically, what I'm looking to do is ensure that we don't do surgery on folks who might not have the ability to really understand what's involved with weight loss surgery, or to be able to follow through on the rather major lifestyle changes that are associated with it. So what this really involves, first of all, is just screening for major contraindications, such as untreated psychotic disorders, active substance use problems, or dementia. But what I also want to make sure we do is to facilitate the veteran's weight loss goals. This includes things like identifying and directing treatment that might be necessary for any mood or anxiety conditions. We also want to make sure that any behavioral patterns that would create a problem in terms of keeping up with the post-surgical lifestyle, we identify solutions and troubleshoot them before surgery rather than let them become a problem afterwards. And for each person, we want to identify the strengths and weaknesses and direct any resources or treatment that might be indicated. So what does this involve? First, I do a very thorough medical review of the patient's chart just to make sure I have an understanding of where the person's coming from. I do a structured clinical interview, kind of following this guideline here, and really takes as much time as is needed, but usually it's about a half an hour to an hour and a half, just depending on what we get into. Then there are some formal assessments that are on the computer, and these also take about 30 to 60 minutes. We're looking at things such as alcohol use, any depression or anxiety symptoms that might be present, as well as how the person adapts and copes with health problems and health interventions. After this is all done, I put together a comprehensive report, let the team know, and then we meet together as a team to review everyone's impressions. And following that, I'm going to continue to stay in contact with each veteran who goes through this, just to make sure that the mental health goals are being met as well as the weight loss goals. Thank you very much.
Good afternoon. My name is Tony Abramchek, and I'm the clinical pharmacy specialist with the bariatric surgery team here in VISN 7. My role with the team can be broken down into one word: medications. My job is to get you off of as many medications safely as you can as a result of your hard work and the work of our bariatric surgery team to provide effective weight loss. What I will do is I will hold a telephone visit with you after you have been approved by our bariatric surgery team for a weight loss procedure. It could be anywhere from a couple weeks before to just right before you're about to go in for your pre-op evaluations. At that visit, we will talk about a couple of specific things. Number one, we will look at medications that can impair the absorption of getting into your bloodstreams in terms of their effectiveness and how that will be affected as a result of the procedure. Number two, we will look at medications that might impair the ability for you to lose more weight, since it is so important for you to lose the weight in the first 6 months after the procedure. We will look at medications that may not be able to be crushed and may have to be chewed, and be able to make recommendations to your providers about appropriate medication changes that you'll need after the surgery. After the surgery, I will follow you over the telephone every month for 6 months, looking particularly at your blood pressure, your blood sugars, and your cholesterol levels, as these tend to be emergent meds that need to come off of rapidly as a result of successful weight loss. Once we have done that, we will do a review of systems that start from the head and work their way down in terms of the systems of the body, making sure that we know the medications that you're taking or not taking. I can also be assistance and be able to help you wean off your pain medications after the procedure as well, as this can become important. After the 6-month period, by then we should have gotten you off of all the emergent meds and gotten you into a more stable medication regimen. I will work with your primary care provider and the physician assistant and the surgeon with the bariatric team on this. My hope is that we can get you off as many medications safely and effectively to help accelerate your weight loss procedure. Thank you.
After the initial consult and these preoperative evaluations, we meet as a team and discuss your case to see if you would be an appropriate candidate for surgery. If we find that you are a great candidate for surgery, you will be then set up for a history and physical exam, nutrition class, and anesthesia workup. Now, Dr. Rana Pulat, our Bariatric Medical Director, will now discuss each of these surgeries.
Good afternoon. I'm Rana Pulat. I'm the Vision 7 Surgery Director. I am here to discuss the surgical procedures that we offer and go over some of the postoperative issues and complications. The two procedures we are going to be discussing are the gastric bypass and the sleeve gastrectomy. These are the primary procedures we are going to be using in this VA. So gastric bypass, how does it work? It is both a restrictive as well as a malabsorptive procedure. We divide the stomach into a small little gastric pouch that can hold about 20 to 30 cc's. And then we also bypass the first portion of the small bowel, causing some malabsorption. Of late, we have research identifying that there are hormonal effects in addition to the restriction and the malabsorption that goes on with the surgery. We obviously have to have a lifestyle change and new diet and life habits for the rest of your life. The surgery itself, gastric bypass, takes about 2 hours. There's a swallow test done the day after surgery. The drain, we leave a drain in, and the drain is in for about 3 to 4 days. We keep you in the hospital for about 3 to 4 days, and usually, depending on what kind of work you do, return to work as in about 3 to 4 weeks. The possible complications for gastric bypass are pulmonary embolus, which is a clot in your lung, a deep vein thrombosis, which is clot in your leg, leak. The rates of leak with the new generation staplers and improved technique are less than 1%. Stomal stenosis, which is about 3 to 4%. Stomal ulcer, which is about 8%. Wound infections, which are very low with the laparoscopic procedure, which hopefully a great majority of the patients who end up with surgery in our VA are going to get them laparoscopically. Bowel obstruction, which can happen at any point of time after gastric bypass, which is why abdominal pain and emesis after a gastric bypass is considered an emergency, and we, as the primary bariatric team, ought to know about it if those are the issues you're having, which would probably manifest as pain, nausea, and emesis. Staple line bleed, which is more of an acute issue, which we probably will be able to handle while you're in the hospital, in the region of 4 to 6%. Overall, the mortality rate for gastric bypass is less than 0.3%. So what is gastric bypass? What is the expected weight loss? The expected weight loss is calculated on the concept of current weight and ideal body weight. So excess body weight is obtained by subtracting the ideal body weight from your current body weight. And so for an example, if the current body weight is about 300 pounds and your ideal body weight by our chart is about 150 pounds, then your excess body weight is 150 pounds. So with gastric bypass, you're expected to lose, with diet and exercise, you're expected to lose about 60 to 70% of the excess body weight. So 60 to 70% of 150 pounds, which works out to be about 105 pounds total. The next operation I'm going to be talking about briefly, which we offer, is a sleeve gastrectomy. So how does a sleeve gastrectomy work? We perform a longitudinal sleeve gastrectomy where we resect a great portion of your stomach, which is the fundus and the body of the stomach, which is a more expandable portion of the stomach. So we use a bougie to resect that portion of the stomach, and we remove that entire portion of the stomach with a small incision made in the left subcostal region. So this, again, is done laparoscopically through small holes. So how does it actually work? It works by both restriction, where your amount of food that you can take in at any point of time is a small quantity, as well as we know there are hormonal effects for a sleeve gastrectomy by inducing satiety. Obviously, just as in the case of a gastric bypass, you need lifestyle modification, diet modification, and lifetime follow-up. Sleeve gastrectomy approximately takes about an hour to do. We do a swallow test the day after surgery. You're in the hospital for 3 to 4 days. There may or may not be a drain placed, which may be removed at about 5 to 7 days. And return to work is again 2 to 4 weeks. Complications for sleeve gastrectomy include leak, which is again around about 1%, bleeding, which is about 1.1%, stenosis of the sleeve, which can manifest as a leak in the region of again 1%, and mortality rate is comparable to a gastric bypass, which is about 0.2%. Expected weight loss for a sleeve gastrectomy, again, is calculated by the same concept of excess body weight. The weight loss is slightly lesser than what you would expect in a gastric bypass. So the weight loss is usually about 50 to 60% of excess body weight. And in a 300-pound patient, you could expect to lose about 82.5 pounds. Of late, the 5-year data has been encouraging with a sleeve gastrectomy, proving its long-term durability. So summary comparisons between a gastric bypass and a sleeve gastrectomy. Gastric bypass works on both a restrictive, malabsorptive, and hormonal mechanism. Sleeve gastrectomy works on a restrictive and a hormonal mechanism. The weight loss is most rapid in the first 6 months, and you can lose weight up to 18 to 24 months, and the weight loss difference between the two procedures are about a 10% excess weight loss with a gastric bypass compared to a sleeve gastrectomy. Of course, the determination of whether a patient would have a sleeve gastrectomy or a gastric bypass will be done on consultation, but generally people with diabetes mellitus and reflux do better with a gastric bypass than a sleeve. The expected weight loss comparison, as you can see in the slide, for a 300-pound patient is 105 pounds for a gastric bypass versus 82 pounds for a sleeve gastrectomy. Both procedures help with the improvement of the chronic conditions that come with morbid obesity, which include cardiovascular disease, diabetes mellitus, gastroesophageal reflux disease, sleep apnea, hypertension, venous stasis disease, and metabolic syndrome. The most dramatic improvements are in people with diabetes mellitus and metabolic syndrome, where there's about an 82% resolution of diabetes with this procedure. Possible weight regain. There is about a 15 to 20% recidivism rate with these bariatric surgery procedures. It usually occurs after the 2nd year, and this is usually because the patient has failed the procedure rather than the procedure failing the patient. It usually is from dietary indiscretion, as well as not changing your exercise as well as lifestyle. So the bottom line is, to succeed with this operation, there has to be a dietary and a lifestyle change in addition to getting the surgery. So the weight loss surgery objectives, what we are doing with this procedure is actually giving you the best tool that is out there to lose weight and help you lead a better life and help your quality of life and improve your chronic medical conditions. We expect out of you lifelong dietary changes, a change in your behavior as far as exercise and dietary and lifestyle modifications, and a regimented exercise program. Thank you.
So hello, my name is Kristen Crady. I'm the dietitian for the bariatric team here. And you will see me a lot pre-op and post-operatively. The first thing that I like to do with my patients is I kind of get a baseline interview. And in that interview, I talk about your current food habits. We talk about eating patterns that you've had, environmental factors that maybe have contributed to significant weight gain in the past, and how we can kind of reverse those. We also talk about your current height and weight, and I give you a goal weight of what I expect you to be when you have finished losing weight by the end of it. After that interview, and I will add the interview, we can either do over the telephone, we can do it face-to-face, or over VTEL if it's available at your medical center. After that interview, we will sit down, again, either face-to-face or over VTEL, and I go into a 1 to 2 hour session, much more in depth. We talk about the post-op diet. We talk about meal planning. We talk about sample menus. I bring out my food models, and we kind of go through in great detail what a typical day will look like for you after surgery. So these are the things that we kind of look at in that during that in-depth education. Smaller portions of all foods for the rest of your life. Avoidance of sugary foods. No eating and drinking at the same time. In addition to foods in general, we will talk a lot about activity and how you can incorporate more activity into your life. We don't expect you to be able to run a marathon, but everybody is a little bit different, and we do expect you to incorporate something, some kind of physical activity into your daily routine and daily life. In addition to those things, I teach you more about preparing healthy foods that will keep you healthy for life, lower in fat, higher in fiber, lots of fruits and vegetables and protein. And then on top of all that, we definitely stress the importance of routine follow-up for life. You will see me for life, and you'll see the team for life. The longer out from surgery you go, the less you follow up. But this is a lifelong commitment that you are agreeing to. You're agreeing to the relationship with the bariatric team. Some important tips I just want you to remember. Every bariatric center is a little bit different on how they advance their diet. We advance fairly quickly here at the VA. Day 1 post-op, you'll be on a clear liquid diet. Day 2 is a full liquid diet. Day 3 is a pureed or baby food consistency diet. You will stay on that for about 1 month, and then you can begin the transition to a soft or regular textured foods. In addition to the progression of the diet after surgery, one thing that you'll have to do for the rest of your life is take certain baseline vitamins and minerals. They're listed up here. The complete multivitamin, you'll have to take 2 of those a day, 1 vitamin B12, and 6 calcium pills. This is calcium citrate, and you can't take them all at once. You have to take them separated, 2 pills 3 times a day. These are baseline vitamins that you will have to take regardless of any of your vitamin levels for the rest of your life. In addition to vitamins and minerals and the diet progression that we just talked about, I run the monthly support group. If you are not local to the Charleston area, I can work with your move coordinator to get you hooked up with something in your local area. If you are local to Charleston, I strongly encourage you to join our group and participate. Research shows that the more participation you have, the better you'll be long term. I look forward to working with you, and thank you.
As you can see, bariatric surgery is a team approach. Your part is a lifetime commitment. While generally safe, bariatric surgery has risks. Losing weight after bariatric surgery is far from automatic. It takes commitment to lifelong changes in eating patterns and lifestyle habits. It's important for you to remember the VA is providing you a service to help you reach your goals and to make you a healthier person. You must be 100% dedicated to making these changes in order for your weight loss surgery to be successful. Routine lifetime follow-up is you meet with the various members of the team to help you, coach you along the way, and to ensure that you're to avoid any nutritional deficiencies or other complications or problems. We see you at set intervals at 1 week after surgery, 1 month, 3 months, 6 months, 12 months, 18 months, and 24 months, and then annually after that. We also do blood work every 6 months and as needed. We do ongoing education, various bariatric support groups, or we work to get you linked into support groups in your area. The follow-up for patients outside of the Charleston area, we are working to establish telecommunications, and as that's available, we can utilize that to help with follow-up appointments. So what's next? In order, if you meet the prior qualifications as we discussed, you must be a veteran enrolled in the VA health system and be in VISN 7. Discuss with your primary care if you think you may be a good candidate. It's important that you both make that decision together before the referral is made. The primary care also plays a vital role in helping us with medical management after surgery. Once you guys have made that decision, your primary care will make the referral to the bariatric point of contact in your area. The consult is received, we review the chart here, and if we feel you're a great candidate, then we go ahead and get you set up for that initial consult appointment. Again, thank you for participating and listening to us today. We look forward to meeting and working with you. Our website is below that. If you have any questions, it's a great resource to serve. And again, if you feel like you're a great candidate, please discuss with your primary care. Thank you. Have a great day.